ago, our organizers, we attended a congressional hearing in D.C. for Medicare for All, and we got to hear and meet Adam Garden speak about how he's suffering from ALS, and basically how he's relying on his GoFundMe account to fund his medications, how he's spending his last few days worrying about how he's going to pay for his health care as opposed to spending his last days with his family. As president, how can you implement not only just a Medicare for all, but just health care for all plan in the United States of America?
Excellent question. I sometimes have to take a step back and realize how shocking it is what you just described taking place in the wealthiest country on the face of the planet. A country whose taxpayers, all of us, paid for many of the innovations and cures and medications that are then sold back to us at the most expensive rates on the planet. I'll give you another example. Insulin was developed 97 years ago, and we had people dying of diabetes in the United States in the year 2019. Or, as you just suggested, crowdfunding their ability to receive the medication they need to be alive. Getting to guaranteed high-quality universal health care is our top priority. Making sure that we get there as soon as possible is critical to saving lives. Our plan calls for everyone who's not insured today, tens of millions of our fellow Americans, to be able to enroll in Medicare immediately. Those who are insufficiently insured, so they have insurance, but their care is not guaranteed because they can't afford a copay, they can't meet the premium cost or bridge the deductible, they can choose to enroll in Medicare as well. And then those who have employer-sponsored insurance, members of unions who have bargained for world-class healthcare plans at the expense of their wages, they're able to keep those plans if they work for them and their families. That gets everyone in this country to the doctor, the provider, the therapist necessary to be able to get the care that they need. And the last thing, and perhaps front of mind here in Georgia, we're also going to make sure that universal care means every woman makes her own decisions about her own body and has access to the care that makes that possible. So thanks for asking the question. Appreciate it.